Now we have statements by the Ministry, if any. Minister of Health.
Thank you very much, Speaker. As we continue our fight against the third wave of the COVID-19 pandemic, it is critical that we recognize the incredible efforts and sacrifices made by physicians across the province and offer them our thanks. May 1st, 2021 marks National Physicians' Day in Canada and Doctors' Day in Ontario. Speaker, I am pleased to rise today in the House as Minister of Health to express my gratitude and appreciation to all Ontario physicians for the critical and life-saving services they perform on a daily basis. Ontario's physicians truly are our heroes. They make a tremendous difference in the lives of countless patients and families every day, but especially in our fight against COVID-19. Since the start of the COVID-19 pandemic, physicians have been on the front lines of Ontario's response and have worked tirelessly to continue to deliver the exceptional care that patients expect and, of course, deserve. This past year has truly been unprecedented, presenting Ontario's healthcare system and our physicians with challenges unlike anything we have ever seen before. Days like this remind us all to recognize and celebrate the incredible courage, commitment, and compassion of physicians here in Ontario and across the country. Our physicians work around the clock, sacrificing precious time with their loved ones, facing exhaustion and burnout, and putting themselves at risk to protect the health and well-being of Ontarians. Despite the sacrifices required, especially during this pandemic, we continue to see more and more Ontarians dedicate themselves to a life of service by taking the Hippocratic Oath and becoming a physician. In fact, we expect to see an average annual net increase of approximately 581 physicians each year until 2029. Even with all of the extraordinary challenges presented by a global pandemic, physicians continue to demonstrate remarkable leadership and compassion while providing exceptional patient-centered care to patients and families across the province. This includes, but of course is not limited, to diagnosing and treating patients for illness and injury, supporting patients in managing chronic conditions such as diabetes or high blood pressure, performing life-saving surgeries, and prescribing patients with the medications they need in order to care for their health. Day after day, Mr. Speaker, physicians rise to the challenge to be there when we need them the most. We are very, very thankful for their heroic efforts to keep Ontarians safe. As we rightly recognize physicians, we also know there are so many other healthcare providers, nurses and nurse practitioners, therapists, pharmacists, paramedics, physician assistants, personal support workers, and many others who are caring for Ontarians during this pandemic. Speaker, our government is doing its part to ensure these heroes have the supports and resources they need to continue to provide the care that patients and families expect. To protect these frontline healthcare heroes, we are investing $1.4 billion to procure personal protective equipment to help keep them safe from harm. Our government also recognizes the challenges facing physicians currently working in the hospital sector, which is under significant strain. We are using every tool at our disposal to support our physicians, our hospitals, and other personnel working in them to ensure they have the supports they need as they respond to COVID-19 and continue to care for patients. To that end, we have invested over $5.1 billion since the start of the pandemic, creating more than 3,100 additional hospital beds for patients. This includes 185 beds at Mackenzie Health's Portalucci Vaughan Hospital, which has been temporarily transitioned into a system-wide resource supporting the province's COVID-19 response. Vaccines remain our greatest tool to help protect our physicians from becoming overwhelmed with demands for care, stop the spread of the virus, safeguard our health system capacity, and help save lives. We continue to roll out Phase 2 of our COVID-19 vaccine distribution plan, vaccinating more and more people every day, prioritizing those with health conditions in congregate settings and in hotspot communities with the highest rates of transmission, hospitalizations, and deaths. And once again, Ontario's physicians are stepping up to support this effort and help ensure that there are brighter days ahead for all of us. Across the province, physicians are volunteering to administer vaccines in mass immunization clinics, mobile clinics, pop-up clinics, as well as primary care settings. By prioritizing those at greatest risk for vaccination, we will reduce transmission of this deadly virus and protect our communities and all of the brave men and women who work every day to keep us healthy. As we celebrate National Physicians' Day and Doctors' Day, we should all take a moment to recognize the critical role that doctors play in building strong and healthy communities and their unwavering commitment to protect the health and well-being of all Ontarians. Physicians are the foundation of the strong, connected public health system that we continue to build in this province, and their continued resilience is truly an inspiration to all of us. On behalf of our government and all Ontarians, I want to once again thank all of Ontarians' physicians for their service during these truly unprecedented times and for continuing to provide us with world-class health care. Thank you, and thank you, Speaker.
Thank you. Statements by the Ministry. Responses. The member for Nickel Belt.
Thank you, Speaker. And I'm really proud to join everybody in Ontario on Saturday, which is May 1st, for Doctors' Day or National Physicians' Day. I want to thank Maria Di Cantia, who is the Senior Advisor for Government Relation and Advocacy, Corporate and Public Affairs at the Ontario Medical Associations, for some of those notes. Starts with, Ontario doctors have been on the front line during the COVID-19 pandemic, working to keep their patients healthy. Ontarians can show their appreciations for doctor services during the pandemic by turning on their phone flashlight and holding them high on May 1st, that's Saturday, at 9:00 p.m. The Ontario Medical Association is organizing this province-wide expression of appreciation as a way for all Ontarians to recognize doctors for their bravery and their dedication. Ontario has been celebrating Doctors' Days for many years to recognize the countless ways doctors lead us to better health. This year, the second Doctors' Day occurring during the pandemic, they want to once again recognize how doctors, Ontario doctors, are continuing to work through the waves of COVID to take care of their patients. Shining a light has become a universal way of expressing gratitude for those leading the way out of those crises. More specifically, in Sudbury, we will be celebrating the physicians in ICU on this Saturday. Unfortunately, with the restrictions, nobody can join, but everybody can see what will be happening. On May 1st, on National Physician Day, Health Sciences North, which is the name of the hospital in Sudbury, all of the intensive care unit staff will acknowledge the work of their internists. Those are physicians who work in intensive care. The COVID-19 pandemic has called upon the expertise and skills of our intensivists. Despite all of the restrictions from lockdown and restrictions, chronic diseases and medical emergencies continue to arise. Providing medical care during a global pandemic has required teamwork at its highest level, and our doctors are fundamental to this effort. Amid the pandemic, they recognize the doctors for their selfless services. Our intensivists at Health Sciences North have been steadfast partners supporting the safety and wellness of their patients as well as the staff they work with. They've helped everybody adapt their practice as more is learned about the virus, its treatment, its prevention, and how it spreads. As we celebrate this day on Saturday, May 1st, we honor the contribution and dedications of our doctor in the worst of time. This day gives us the perfect opportunity to salute their work. Also joining in this, recognizing this heroic work, are a number of local businesses that have put together gift baskets to give to all of the physicians in ICU as well as the other staff. And I could name a few, but Chris Independent, Old Soul Soap Factory, the Nickel Refinery, a group of businesses, lots of them from Nickel Belt, who have put those gift baskets together, and I thank you. I also want to talk a bit about a request from physicians who works in integrative care. This is physicians who provide care for people that have myalgic encephalomyelitis, chronic fatigue syndrome, fibromyalgia, environmental sensitivity, multiple cultural chemical sensitivity. To bring you back, 10 years ago, we were hoping for a center of excellence. A study was done, and we finally agree on a center of excellence. We need to have a standard of care here in Ontario for integrated medicine to work with people who have environmentally linked diseases that are often multi-organ conditions. So we hope very much that the report from Dr. Brian Schwartz, the VP of Public Health Ontario, will be coming to the Ministry of Health soon. My last ask for to recognize and honor physicians is to respect them. The Premier cannot go and say, oh, you can now get the vaccine from your physicians without having spoken to any physicians, but they sure got the phone calls. So, merci beaucoup. Thank you very much. Chimiwich to all Ontario physicians.
Thank you. Responses? The member for Ottawa-Vanier.
Thank you, Mr. Speaker. Doctors across Ontario have been working tirelessly during this pandemic to safeguard the health and safety of Ontarians. These men and women have been on the front lines and in the heart of the action during what could be considered the most challenging times during their careers. Either during virtual visits or taking extra precautions in person, the day-to-day routines change overnight for all medical professionals. Nonetheless, not all doctors are treated and remunerated equally. This difference created a deeper rift in our health system with the new working condition brought on by the pandemic. Doctors who are remunerated using fee-for-service were in positions to adjust easily due to their billing model, but have suffered because of it. Since virtual and phone appointments are not remunerated to the same extent as in-person appointments, along with a lower number of Ontarians willing to see their doctors during the pandemic, the number of patients that doctors see has decreased significantly. This creates much added stress to clinics that do their best they can to keep staff on the payroll and continue to provide such essential services. On the other hand, those who have remuneration using the capitation models have been impacted very differently. Since they are also experiencing a decrease in appointments, the road ahead doesn't look promising due to the expected influx of patients after the pandemic. At that point in time, the surge of Ontarians finally wanting to visit their doctors will create much stress in such clinics due to their remuneration model. I want to take this opportunity to thank all doctors and physicians for their dedication to their professions and to their fellow Ontarians. We have seen the resilience that our doctors have demonstrated so far during the pandemic, and for that, we need to make sure to be there for them in return. To do so, we need to ensure the funding models take into consideration the ongoing realities so that all Ontarians are looked after. Thank you, Mr. Speaker.
Thank you. Next, we have the member for Guelph.
Thank you, Speaker. It is an honour to rise today to offer heartfelt thanks to doctors across Ontario, to honour National Physicians' Day and Ontario Doctors' Day on May 1st. Speaker, doctors have done so much to serve our community and care for our loved ones through this pandemic, whether it's dealing with changes in emergency rooms, incubating patients in our ICUs, or being forced to pivot to doing online support to their patients. Doctors have truly been heroes during this pandemic. Speaker, Ontario Doctor Day was established on May 1st to coincide with the birthday of Canada's first female physician, Dr. Emily Stowe. And while I want to thank doctors across Ontario, I want to highlight two female doctors in my riding who have really stepped up during this pandemic. Dr. Nicola Mercer, who is the Chief Medical Officer of Health and CEO for Wellington, Dufferin Guelph Public Health, was the first medical officer of health to issue a mask mandate in Ontario. And I can tell you, Speaker, from some of the responses that came into my office, it was a very courageous thing to do in the early days of the pandemic. And I want to commend her for that. I want to commend her for having the courage and the foresight. Others followed her lead. She was also taking a huge lead in just establishing a vaccine rollout plan and having an online appointment portal ready to go far before others did in Ontario. I also want to thank Dr. Anne-Marie Zadlik, who in the early days of the pandemic set up our first testing clinic. And it was in the days before we really knew much about what COVID was like. And I remember her, because she would call my office asking for PPE or asking for help or asking for this, or could I call the government for that? And I just thought the courage she showed and the courage other doctors showed setting up that testing clinic and working with COVID patients in the early days before we really knew how the disease spread or how it spread. And so on May 1st at 9 p.m., when we all raise a light to doctors, I just want to say thank you for your bravery, your dedication, the fact that you put patients first. And I want to conclude by thanking doctors who have been speaking out. Doctors oftentimes don't get political, but I want to thank the doctors who have been speaking out through this pandemic, Speaker. Thank you.
Thank you. That concludes our ministerial statements.